Welcome to the AUANews Inside Tract Podcast, an official podcast of the American Urological Association. Thanks for listening. For more episodes of this podcast, visit www.auanet.org/podcast.
I'm Sam Ivan. I'm from Fox Chase Cancer Center and representing the Residents and Fellows Committee of the AUA. And we're back with another episode of Training Transformed, where we're looking at unique educational opportunities at different residency programs across the U.S. For this episode, I'm really excited to talk with a group from the University of Minnesota and hear about what they've been doing with some global urology education. And so I want to introduce real quickly who we have with us and then get into the discussion. I'm going to just introduce you guys by name and then have you tell us who you are and where you are kind of in your urology journey. I'll start with you, Dr. Philipp Dahm.
Yeah, thank you, Sam. Thank you for having us. My name is Philipp Dahm. I'm a professor of urology at the University of Minnesota. I'm the vice chair of education, and I'm also the residency program director.
Excellent. All right, and then Pooja.
Sure. Hi, Sam. Thanks for having us. My name is Pooja Srikanth. I'm one of the fifth-year residents at the University of Minnesota, going into reconstructive urology next year, and I'm very excited to be here. Thank you.
Awesome. Great. And then one more, Lane.
Yeah, thanks for having us, Sam. I'm Lane. I'm another PGY5 with Pooja. I'll be going into andrology and fertility next year for fellowship.
Awesome. Very cool, guys. Well, excited to have all of you with us and to hear more about the program. But, this was, I heard about this and it really piqued my interest. But I need to know a little bit more kind of what it is. So, Philipp, can you give us a little bit of background? How did this start? What is it? And just give us a little bit of the lay of the land.
Yeah, so what we're talking about here is a partnership between the residency programs at the University of Helsinki in Finland and the University of Minnesota. And this is a program that has been in existence since early 2021, so approximately for 4 years, and has involved 2 rounds of exchanges, twice residents and in one case faculty from Helsinki University have visited us in Minnesota, and twice we've been able to send a delegation of residents there accompanied by 2 faculty members. So this is what it is. In terms of how this came about, I can't exactly tell you how it happened, but I have a friend and colleague who is a faculty professor of urology there at the University of Helsinki. His name is Kari Tikkanen. I've known him for a long time, probably for 15 years. We share some common interests in evidence-based medicine, systematic reviews and guidelines. We published together, and this was during the height of the pandemic. We probably had a little bit more time on hand, and we probably spent more time on conference calls than we otherwise did. And we realized, I believe, that we just didn't really know anything about training in the other's respective country. And somehow we had the idea that it might be a cool thing to start up some kind of exchange or partnership. And this was the initial idea, and this is how this all came about.
Yeah, that's so cool. And I think it's really neat to see another example of, obviously the pandemic was such a stressful and difficult time in so many ways, but it's very cool to see some of these unique silver lining things that came out of it, where some remote collaboration really spawned something really cool. So what initially did this look like? Was this remote conferences? Was this lectures? How did it start, and then what has it grown into?
Yeah, so we tossed the idea around between the 2 of us, and then we broadened the circle. We included our chairman, who was very enthusiastic about the whole idea right from the beginning, which of course was important because we did need some funding for this program. I also, the associate program director at the time was Mike Borowski. He was very interested in this. And then the program director at the University of Helsinki, his name is Antti Rannikko, was interested. So we had some planning calls, and then the initial call was an introduction to this program for the residents at both sides, just kind of laying out the outline of what we're hoping to do and why, and how that might benefit the residents from both programs. And then the second call was one where we paired residents from the two programs and asked them to connect with each other, and then had a conference call altogether where actually the residents from one side introduced the residents from the other side. So kind of a icebreaker exercise.
Oh, great
And
idea.
then in the very first year, the third call then was already case-based, which is kind of the backbone what we do now virtually. Was a conference that was focused on endourology cases. We had each group present, I think, maybe up to 2 cases from each institution, and we discussed, how each respective side would typically manage these patients.
Awesome. Very, very cool. Lane and Pooja, what, from a residency trainee perspective, how were you all involved with the evolution of this program? Because it presumably started when you were early in your residency and you've gotten to grow with it a little bit.
Yeah, so I think a lot of the planning stages, we were kind of just watching a lot of it evolve. I think the first few calls were really interesting to see it take shape. We have some pretty funny screenshots from the Zoom calls that we had where we were just kind of meeting each other. They're probably on a hard drive somewhere. I think the first year, if I remember correctly, Dr. Dahm, it was the first round of our residents actually went for a conference, the Scandinavian Urology Association conference. And then the second year was a little bit more kind of less structured and more of an observership, that we went there for a week. So for that visit, for our visit, we got to kind of choose a little bit more. I think our interest was a lot about the clinical work, to see the hospitals and to see what their ORs looked like, what their clinics looked like. And so that was kind of our involvement in the planning. But I mean, to be honest, a lot of the groundwork was done by our faculty, which we're very grateful for. We just kind of got to go along for the ride.
Very cool. And are all of the residents involved with this in some capacity, or is your involvement different during different years of your training?
When we are on the year where we are going to Finland, that's typically the PGY 3s who are selected to go. So I think when the first trip happened, we must have been, what were we? Ones? We were interns, yeah. And then the first 3s went, and then there was a year where they came to us. And so then when the Finnish residents come to us, everybody's involved in giving them a tour, taking them to cases, showing them what clinics like, what our daily life is like, showing them our ancient pagers, which they had a good laugh about. And they actually took photos of it so that they could take it back to the residents back there, and are like, look at this. This is like from the 90s.
Yeah.
But
that's a great point. Were there any other things that Finnish residents coming to the U.S. just found very bizarre or thought were interesting? Other things that you picked up that they thought were very noteworthy?
They were shocked how early we rounded. They like, when we first went there and we were like, okay, when Pooja, Jonathan, and I were PGY 3s and we traveled to Helsinki, the first day we were like, okay, where do we meet you and what time? And they're like, oh, we'll come pick you up. We'll get to the hospital. I don't know what it was, like 8 or 9. And they're like, we have coffee now. And we're like, but don't you round? And we're like, no, we have coffee first. We talk about the day and the patients, and then we round. And we're like, oh, okay. So that's a little bit different than just chugging a pot of coffee and then running off to see the patients. It's they value kind of the quality of life a little bit more than I would say that we do. They like to enjoy their time, talk about things, spend a little bit more time thinking about patients and things like that than us rushing around to the operating room.
Gotcha. Okay. And I guess a corollary to that question would be, I know both of you have been to Helsinki now. What were some of the things you picked up when you were there that might have been different, aside maybe from that cultural difference, but what other things did you pick up that were a little bit different?
Probably the biggest thing that we picked up is the training paradigm there is just quite different. I think the way um, the years are kind of organized. I think in the US residency programs, especially surgical programs like urology, they tend to be kind of a grinding mindset, right? You're in training for 4, 5, 6 years. You work really hard, you have long hours, and you kind of fit your training in um, with the goal of graduating and going out and starting independent practice. I think um, the paradigm there is a little bit different in that, for one, the 5 year timeline is a little bit more of like a guideline. I think they have a lot more emphasis on being truly competency-based training, which I think a lot of American programs we want to be competency-based, right? We work on that. That's how we give our feedback. But there, the length of training is really dependent on uh, once you've reached competency, that's when training is over, not necessarily right at the 5 year mark. Um, and I think like hours wise, pay wise, uh, it's not so much a grind as it is kind of just a job. Residency is just a job, and you do it for a period of time, and then you become an attending, and then that is another job that you take. It's you're not expected to kind of place your life on hold, so to speak, like a lot of there's kind of a feeling of that here. Um, People take time off to have children, they take time off to take care of life events, and if that extends their training time, that's okay, because it's not so much about like getting to the light at the end of the tunnel kind of thing. So it's a very different training paradigm. I think there's pros and cons about both. Maybe the best balance probably lies somewhere in the middle of both of those things.
Yeah, that is very interesting though. And I'm sure there's many things that play into that, both, culture and compensation and incentives and where all of that is wrapped up. I'm sure it differs a lot, but that's so interesting to think of residency. Not, I think you put it pretty succinctly. It's like finding the light at the end of the tunnel. Um, I think most people in the US would agree with that. But that's super interesting. Okay, so I want to talk a little bit about kind of how this works practically and get a little bit more of the detailed information to understand this a little bit more. And then I do want to circle back and talk a little bit about the impact of this. But first, just from sort of an operational standpoint, um, Philip, you mentioned this does have to get paid for somehow. So how have you guys figured out a way to operationalize this and make it functional and feasible?
Yeah. So I actually made sure to confirm that I would give you accurate information. I texted with our chair um, late last night and today. This is actually purely paid by the department by its educational funds. So we're most grateful for that.
That's great.
We each program is responsible for its own funding. So when our residents go to Finland, we pay for travel, accommodation, per diem, and so on. Now, they will oftentimes put on special events, right? They will take us out for dinner, and all those programmatic things are covered by them, but kind of the base funding comes from each programs, and so far that has worked well.
Great. No, that's great. And I think very cool to, as a program, be able to kind of take that step um, and lean into this as an educational opportunity and make it a priority. I'm sure this hasn't been easy to do. What have been some of the challenges, or what do you feel like are some of the limitations of putting all this together?
Yeah, thank you for that question. I think you spoke to the issue of funding. This does cost a considerable amount of money, and a lot of medical centers and departments are facing a lot of financial constraints. So funding has been difficult. I think initially when we started this program, the hope was to do this annually, to actually give every year, to give residents the opportunity to go to Finland, and maybe also host residents from Finland at our institution. That just does not appear to be feasible, and one of the major constraints is the funding. So now we send our residents every other year, right? And it's been a popular trip. Residents have enjoyed going, right? But we can't offer this trip to all of our residents, unfortunately. Now we've not talked about it. It's a separate endeavor. We actually have the opportunity for residents to go to Honduras. That's 1 or 2 residents per year. That's a separate thing. That's a little bit like an alternative. If you don't go to Finland, maybe you'll go to Honduras. But if the funding wasn't the way it was, we might set it up to be an annual thing, and that would be preferable and would make it easier to remain in contact, right? It would strengthen the connection, the bond.
Okay, Lane and Pooja, one of you guys, I know you guys both have gotten to do this Helsinki trip. Can one of you guys give me a rundown of the trip there as a U.S. resident going there? And then can one of you give me a little bit of a rundown of what it's like when the Helsinki residents come to Minnesota?
Sure, I can talk about the trip there. So basically, day to day, it's a week-long trip. We arrive, I believe, maybe our first night there, we had a really nice welcome dinner with the residents there, as well as some of the faculty members there. 2 of our faculty also came with us and got to spend time there. We basically got a schedule on that first day, and it said, you're Pooja, you're going to this hospital this day. Lane, you're going to this hospital this day. Here's the right tram to take to get there. We'll meet you at this time, show you around, the clinics, the OR. Some days were surgery days. I spent some time in a clinic with one of the residents who was doing local procedures under local. That was very interesting. And then I actually got to scrub in to a couple of cases. As I mentioned, I'm going into reconstructive urology, and maybe coincidentally, or maybe not so coincidentally, I was assigned to work with their reconstructive urologist, and I got to scrub into a few cases with him, and that was a wonderful experience. I mean, I'm not sure if it was allowed, but I did. And I really liked working with him. I think Lane and Jonathan got to watch some of the robotic cases there. And then if I was at one hospital one day, they were at another, we'd switch. So we got to go to all the different training sites. And then in the evenings, we went to dinners, got to experience some of the local culture. I think one of the highlights was we did a sauna trip with the Finnish residents. That was very fun. They showed us, I think it was a pretty traditional sauna experience, you have to jump in the Baltic Sea first, and
Yeah. What
it's
what
very
time of year
cold.
what time of year were you there?
Um, Gosh, it was April, I think, wasn't
Okay.
it?
Probably still pretty chilly.
It got into the bones for sure. But you jump in the sea, and then you go into a very hot room where they pour water on coals and then steam the toxins out. So, but anyway, so that was what the week kind of looked like, and so got to spend a lot of time with the residents. They were very excited to kind of show us around both their work and their kind of their social culture. So it was awesome.
Very cool. And just for a little bit of context, do you remember how many residents there are at the University of Helsinki, and are there multiple urology training programs in Finland?
This is the main one at the University of Helsinki. They're because of the way their training program works, kind of without the set years, it's approximately 3 per year, I believe.
Okay.
But there's a little bit more flexibility in terms of, who there's not the PGY2s and the PGY3s. There's people who are kind of in their third year of training, but maybe potentially have another 3 years to go just based on where they are in their training
Gotcha. Yeah,
setting.
I had attendings that used to tell me, you just added 3 more years to your residency. But maybe that was the pro of our system that you said, is we can kind of claim that end date. But okay, Lane, tell me a little about the trip when the Finnish residents come to Minnesota. What do you guys show them? What's that week look like?
Yeah. So typically it's around AUA. So I think we've done it both right before and then both right after, where they've either flown in after AUA or they're going to fly out to AUA at the end of the week. So they'll come in. I think last time we had a welcome dinner at Dr. Dahm's house, which was very fun. Some of them brought, what is that licorice beverage that they bring? I cannot remember, but they bring. Do you remember, Dr. Dom?
Yeah, I don't remember the name, but it's a hard liquor that tastes of licorice, essentially.
They bring that and yeah, celebrate with that. But oh my gosh, is that hard to take? Uh, we say hey, welcome in, tell them about what's going to happen the next day, and we basically kind of schedule them at all our different sites. So we have the hospital on the east bank of the Mississippi, the west bank of the Mississippi, which also has the Peds hospital associated with it, and then Southdale, which is kind of the South Metro area, where we would assign the residents to basically follow some of the other residents, going to usually generally the bigger cases, just to see how things are going, how things are different. Many of the Finnish residents wanted to see how, like, what did rounding look like? What does that look? How's that different? I think one of the things that they mentioned is that when they do rounds, they typically do like collaborative rounds with nurses, with the walk teams, with all of that, and so they find it very interesting when we are changing the wounds ourselves and doing all the dressings and things. So that's one thing that, I guess, to answer your previous question, was something unique that they wanted to see. And so typically they come around and they kind of like observe in the operating room, see how things flow. In the afternoon, evening time, it's generally a lighter time, and they start exploring Minneapolis. Many of the Finnish residents want to go to the Mall of America. It's like a thing they always say they want to do, so we will take them to the amusement park. Um, and then generally that happens throughout the week. On Wednesday is our conference day, and so we generally do the what we were talking about earlier, kind of the virtual conference, but in person. And we have a set topic beforehand with a grand rounds lectureship. Generally, when they come, they're presenting a presentation about. I think this last one was about the healthcare in the happiest country in the world, is what they presented, and how healthcare and urology is a little bit different in Finland. And then we did Then we did a shared case presentations around cytoreductive nephrectomies and metastatic renal cancer and how treatment is different between those two. And then I feel like didn't we do like a big celebration at the end, or is that when they had to head out to AUA this year? I can't remember.
We did have a dinner with them, and maybe a few more things to mention. We showed around the campus a little bit. We took them to the Medical Device Center of the University of Minnesota that we're quite proud of our MRI Research Center, and then I think we walked them through some basic science and translational labs. So there was one day that was focused on us showing off a little bit to them all the great things we have going on at the University of Minnesota, and then we had a nice evening event. Oh, you should mention we played soccer with them. Did we
Oh
not?
yeah,
I did not personally, but you did.
No, yeah, our self-proclaimed social chair set up a soccer match between us and the Helsinki residents, which is very fun.
I'm not sure if I want to ask who won.
I
We can.
think we won.
Yeah. Okay. Helsinki residents are going to come looking for receipts on that one.
I'll say we won, but yeah, we had it was a good experience. They were good sports, and I think we kind of sprung that on them maybe a little bit. Said, oh yeah, you get to play soccer with us. They had a good time.
That's great. So very, very cool. So it sounds like these 1 week trips, and the years alternate. So group from Minnesota to Finland and vice versa, alternating years. And then Phil, you mentioned earlier, but are there still some other virtual connections and lectures and things that happen throughout the year? Is there a cadence to the rest thing, or is it sort of a 1 week deal?
Yeah, I very much like the question about a cadence. There's definitely a cadence. We typically arrange for 3 or 4 virtual conferences in between. They never happen in the summer because one of the things that we share with the Finns here in Minnesota is that we take our summers very seriously. So it is very difficult to arrange for anything out of the ordinary during the Minnesota summer. So the summer has to be over, and then things, around Labor Day, business as usual starts again. But then we start thinking about the applicants for next year, and then the residents start thinking about the in-service exam, which is early or mid-November. So typically the first activities start right after then, right? And then we will pick a clinical topic, and then we'll have these topic-based case discussions. We have had, Elaine has mentioned some. One of the first was around stone disease. We've talked about BPH. We've talked about prostate cancer screening and management of prostate cancer. I think we've had reconstruction. We just find some topics that are of shared interest, and we discuss them. And we always try to we try to focus also on how the patient moves through the system, right? Whom does he see? How long does it take? What imaging is done, and we some of the finer points, and just see how the healthcare system might be different and lead to different management choices.
Yeah, I would imagine that a lot of the medicine is similar, but I would think that the systems aspect or the delivery of care or some of those different nuances, there might be a lot of things to learn.
Yeah, I believe I would say they have a truly universal healthcare system. Everybody's insured. Nobody worries about a bill. So there's some fundamental differences to our system.
Very interesting.
Just to jump in, I think those case-based conversations have sparked some of the most interesting discussions about differences. I think we've talked about we've had conversations about like direct to consumer marketing and how that's quite a different way that healthcare is kind of delivered here in America that really doesn't exist in most countries. That the commercials that come on the TV about ask your doctor about this drug, that's just not a thing I think we had that conversation during the metastatic renal cancer discussion, and how, some of these newer, more experimental drugs are, you know, how much have they been studied? How much do they help? How much do they cost? That's always interesting. Um, Again, a difference between our healthcare model. So those case-based discussions, I think, are a really nice way to keep up the dialogue between the actual trips, and learn about the differences in our systems.
Very cool. So that obviously is one big educational takeaway. Maybe just some of those systems based differences. Lane, what other kind of higher level educational themes have you sort of picked out by participating in this?
I think one interesting thing that I've learned is that I feel like we have in the United States, because urology has become so, I guess, narrow and specialized. What I mean by that is the Helsinki residents, they all are like, they do quite a bit of general surgery, and they actually take general surgery call and all do appendectomies, cholecystectomies, things like that. Because they're training to be in these like more community settings, and they are expected to be able to do that call to help those patients. We are so siloed from general surgery to some extent. Like I haven't seen an appy in years. I don't know if I could do one. And so I think that's something that is interesting to me, and something that shows, I think, a difference between our healthcare system and their healthcare system, is that the United States is so focused on, you are going to be the tip of everything, and you're kind of focusing away from the generality and the broadness of healthcare, and trying to be just the expert of one particular thing. And Finland has been, or at least the Finnish residents, and through this experience, I've seen that they embrace more of a like a broader look at things and of healthcare in general. And I think that kind of translates in their training, and being like having to be pretty broad, and like it's many of the residents that we encounter are, going to be general urologists, and that's just what they want to do. And I think a lot of for the United States and residents, you kind of keep climbing the ladder, keep becoming more and more specialized. So it's just a different perspective, I think.
Yeah, that's really interesting, and I think shameless plug. One of our later episodes is gonna talk a little bit more about rural urology, and I think the interesting challenges that we're going to face in the U.S. with the rural workforce will those conversations. You guys are going to get a lot of good perspective. I think we'll have some of the same issues with the crossover and the needs between general surgery and urology in those rural communities. So that's very interesting. Part of this hopefully is to get a sense for how this kind of an experience impacts your residency training. Philip, I know you at least you did medical school abroad, right? Um,
You must have done your homework on me. Yeah. So yeah. So I'm a German. I was born in Germany. I have a interesting childhood. My parents actually worked in Tanzania and in Zambia for 2 years each, and I schooled there. I schooled in South Africa. I finished medical school in Germany, and then I came to the U.S. and trained at Duke. Um, Another thing that was formative for me, I was part of the AUA exchange, right? Just to put a plug in for another AUA program, which was an amazing thing. Anyway, yeah. So I've been fortunate enough to had some exposure to other medical systems. I spent some time in Ecuador, I should mention. Anyway, but I don't think a lot of residents or trainee here in the US necessarily have that opportunity. I think that might be different in Europe. Europe is just smaller, and you just can't help go into a different country and maybe doing an extra trip there, but not so much in the U.S. And and I think a program like this helps broaden your perspective, as is it reflected in the comments by Lane and Pooja.
Yeah.
One aspect that I wanted to emphasize, which I feel is unique to this program, is I feel this is an exchange or a partnership of equals. I think many exchange programs involve a program in the US and maybe a low or middle income country, and it's more taking things to them. I don't know whether we're taking anything to Finland. I think we're learning from them as much as they're learning from us. Things are just different, and can argue which side does things better. So
Yeah. Oh, that's a really good distinction, and it does frame the program, I think, uh, just with a different light from the outset. And I think your word you use, their perspective, I think is probably very key. What do you think, having had all that international experience, do you think you have a little bit of a different perspective on practice here in the US than maybe some of your colleagues would?
yeah, I think an openness to doing things differently, and getting there in different ways, um, might be something I would emphasize.
Yeah. And Lane and Pooja, what would you guys say about perspectives? Have you had perspective shifts, or do you think, as you're finishing up residency really soon, do you think that there are tangible ways that you're gonna go out and go into your fellowship and go and practice that'll be just a little bit different because you've had this experience?
The Finnish exchange is beneficial, but also it's kind of affected the whole residency, I think. Like it's really nice having like Dr. Dahm, who has a different perspective. We have and everybody's so willing to view the perspectives of people all over the country, different, like we have one of our pediatric urologists is from Colombia who provides a different perspective, and everybody's very open to that. We have many staff who have been to different countries or trained in different countries who talked about how beneficial that is. And I think that is maybe part of the reason why. So my fellowship is going to be in Australia. And so Dr. Dom has been really helpful in getting and pushing me to go that way, and I really appreciate that. And I think part of that is this experience in Finland, just seeing things are different there than here. And if we are just always siloed into the United States and we only see how things are done here, you never know how things could be different and how things could be better. And so, that's one of the things that I'm hoping to see when I do my fellowship, is to see, oh, is there a better way to do this? Is there, or is there not? I mean, either way, I'm going to learn. And so I think that having the perspective of everybody who now are seeing all these people from Finland who have different perspectives, and everybody being so open in our program has allowed kind of those thoughts, and allowed us to grow as people, and as urologists as we move forward.
Yeah. Yeah, that makes me think of something you said earlier, Pooja. We get this sort of tunnel vision just trying to grind through residency, and I think we can, in the US, fall prey to some ethnocentricity that just comes as a result of, we're not looking very far beyond the next 5 years. So that's really interesting, Lane, that you're heading abroad for your fellowship. I would say that that's pretty tangible evidence of some impact of the program. That's very cool. Pooja, what about you? What do you think as far as your perspective?
I think for me, I have a educational background in public health and value-based healthcare, and I think that has made a lot of the conversations that we've had with the Finnish residents. Uh, it been very interesting to me. A lot of the kind of economics of healthcare are obviously very different um, between our countries. I think, how we pay for healthcare, how much healthcare costs. There are certainly similar challenges. I think I like that you mentioned the like rural healthcare aspect. I think one conversation that we had with the Finnish residents that's very interesting is the layouts of Minnesota and Finland geographically are actually quite similar. We have big urban centers in the south, and then the north part of their country, the north part of our state, is kind of very rural, very spread out, and a lot of people travel very far to access care. We had just for an example of like an innovation that they have there, a lot of their patients, for example, who are on active surveillance for prostate cancer, they are part of a text messaging system. So every 6 months, they'll get a text message that says, go get your PSA checked. They'll go to like a laboratory center that's close to home. They're not driving hours and hours to get a lab test. When the results come back, they go directly to the physician. If it's normal or if it's stable, then the patients get a text message that says, everything's okay, see you in 6 months. And then, but if they need to have a conversation. So it's very automated and kind of a nice way. You know, we're obviously we're kind of in the developing process of a lot of virtual medicine here. A lot of that was born from COVID. So to see some of that streamlining was very interesting.
Very cool.
Yeah.
Yeah, that's a great example of something you pick up there that you can riff off here in the U.S. and it could greatly impact care for patients here. Very cool. Either of you guys, Pooja, Lane, what do you think? What would you say to other residents? Would you say, and maybe what would you encourage them in terms of reasons to start to think about urology in a global sense, or think about medicine in a global sense, or look for an opportunity like this?
I would say that I guess this is a little bit similar to my last answer, but even though our healthcare systems are quite different, I think we face a lot of similar challenges globally. I mean, we're all countries are dealing with aging populations. We're managing like urbanization and the way that populations are spread out. I think even in a country with a national healthcare system, the Finns are also dealing with challenges with decreases in reimbursement and compensation. And so even though our countries are very different, we face a lot of similar challenges. And I think having the opportunity to talk with people within different systems and share solutions is very, very, very helpful because we're very interconnected, and to see how problems and solutions are dealt with in other places is invaluable.
Philip, so one of the things that I'm really interested in this podcast series is sort of planting little seeds and ideas for people at different training programs for how they can make their training experience better. So I presume there will be many people that hear about this, and like I was, they'll think that sounds really cool, but maybe they don't have this same opportunity where they are in their residency training program. Do you have any ideas for maybe how they could get this type of global exposure, or get some of these similar perspective changing experiences if they don't have the opportunity to do sort of formal exchange like you guys have set up?
Yeah. I do want to say it is interview season, right? So if anybody listen to this is really interested in this Finland exchange, of course, they have the opportunity to match at the University of Minnesota, but that is not really what you wanted to hear. This is a very unique, specific experience that we've set up, but I mean, the big picture thing, it's really good to have exposure to medicine, urology in a different country. And luckily, I think there are more and more programs that facilitate this. International Volunteers in Urology comes up, right? I think lots of programs already participate in this, and even if your program doesn't, your program may very well support you if you reach out to them and have an opportunity. I think you might need to be ready to use some of your vacation time. Your program might not just give you all this time off, and that might be also an issue of equity, right, in defense of all program directors. But I think you can advocate for these international programs if you don't have one yet. Your program, maybe your program leadership is itching to set something up and would value the support in getting something going. And there are external programs like International Volunteers in Urology. So I would strongly encourage everybody to pursue such an experience.
Do you think there have been institutional benefits or department-wide kind of benefits to this exchange program? I can think and see clearly a lot of the individual perspectives and educational benefits, but can you just talk about, do you think there's institutional benefit as well?
I mean, I think it enriches our residency program, right? And for that reason, I think it to some extent it attracts applicants to our program. It is part of this culture that we have at the University of Minnesota, where we have many faculty members that have foreign roots, have trained somewhere else, have had experience anywhere. I think it's part of that picture, that climate, that culture that we're creating at the University of Minnesota. It's one of many efforts to make people of different backgrounds with different interests welcome at the University of Minnesota.
Very cool. I think that's a good way of matching actions to values, and I think that's a very cool program that you set up. Well, thank you all for sharing your experience and giving us some more unique insight to this global urology exchange experience that you guys have set up at the University of Minnesota. I've definitely enjoyed learning more about it, and I think many others will as well. So just thank you again for your time.
Thanks so much, Sam. Appreciate it.
Yeah, thanks for having us.
Thank you very much. This was great. We appreciate the opportunity.
This has been an AUANews Inside Tract Podcast, brought to you by the Residents and Fellows Committee. For more information about the AUA and AUA membership, visit auanet.org/membership.